This Not Without FE forum, and theme of our group is Adolescent SRH and Well-Being in Nexus to Universal Healthcare. This is a very interesting topic, which has been given to this particular group roundtable session. Now, as you're all aware, that world is committed to the SDGs and particularly the health-related SDGs, and the kind of the approach which is being adopted to achieve our health-related SDG targets is the universal health coverage approach. And this universal health coverage approach is a three-dimensional approach, which talks about universality. That means reaching everyone, leaving no one behind. And then the second dimension is the quality of the care. And then the third dimension of this universal health coverage is it should be affordable. That means without any financial burden. So these are the three critical elements. And the issue of sexual and reproductive health is also one of the target under the SDGs, and that is the universal access to SRH. Now, within that universal access to SRH, adolescent is a large chunk of important population group. And to be very frank, when we talk about adolescent SRH, to be very frank, we are reaching too little and too late. And there are a number of barriers in achieving the UHC, universal health coverage, in the context of adolescent SRH. So today, what we do in this roundtable discussions is that, we'll spend maybe the initial 15 to 20 minutes in terms of, understanding what are the variety of barriers which we face or which we think are critical and important in terms of achieving our universal goal of, adolescent SRH, that every adolescent should have that SRH information available, SRH services available, which is affordable, which is of a quality, and it should be available to all, not leaving no one behind. So with this background, so we'll spend 15-20 minutes, and we will request all the participants of the roundtable to share their thoughts. And then the second part of this roundtable discussion, what we are proposing is, once we have identified the barriers for achieving universal SRH access for adolescent health, we will certainly have some ideas that how can these barriers be managed? What are those suggestions? What are the recommendations? So I think because the time given is around 45 minutes, and in these 45 minutes, initial 20 minutes, we'll spend on identifying barriers, and the next 20 minutes we'll spend on getting some kind of a suggestions and recommendation, from this expert group. So I stop here, and thank you very much for joining this interesting session on adolescent SRH and well-being in nexus to the universal healthcare. Now I open this session, for reaction, responses, remarks, observations, but I will request all of you if you can, concentrate in the initial phase of our discussion in terms of, highlighting the barriers. Thank you very much. And maybe I think you can open your cameras also so that we feel more connected as a roundtable session, instead of being a lecture.
Hi, this is Lorette. I don't have my camera on because I woke up at 6:30 to get on a session, and I'm still in my pajamas, so sorry. But I actually think one of the biggest barriers is a lack of political will in many countries, including my own, which happens to be the US. So that's my first thought. Thank you.
Thank you very much. I think this is a very important point. And while making those recommendations, we'll keep in the back of our mind, because the overall, the contour of the session is advocacy and accountability. So this is, one potential area. Thank you very much. Yeah.
Hi, this is Abib. Can I go on?
Yeah, welcome, Habib. Yeah.
All right, thank you.
Good to
Yeah,
see you.
so
Yeah, you feel little
yeah,
connected. Yeah.
thank you. I'm trying to manage my bandwidth, so that's why I didn't put it on while I'm not speaking. Yeah, so I think one of the sorry, I pressed on that again. One of the issues I see with AYSRH within UHA is that adolescents and youths themselves are not on the table discussing these issues. How do we get to advocate that they are on the table within their countries as each country is developing its own UHC strategy? How do we bring in adolescents and youth to those discussions so that they themselves are on the table and not the adults thinking we know what their problems are and trying to put it within the UHC strategies? Thank you.
Thank you very much. I think the point which is absolutely valid is that we need to bring, adolescent and youth at the forefront. I think this is, part of the recommendation, suggestion, which we can certainly make of this roundtable discussion. Thank you very much for highlighting that point, Habib. Yeah.
Okay, good day. Good day.
Yeah,
Did you
good
hear me,
day.
please?
Yes, absolutely,
Yes.
absolutely.
Yes, it's me, Professor Hayat. I'm working in Ahmed Bal University. I'm so happy to sharing this discussion. What about my contribution about this adolescent? The adolescent, all the time I said they are digital generation. All this, what we call it, tradition way to reach them, it will not succeed. They need something innovative. They need something to approve themselves. If we are wanted to really going for adolescent sexual and reproductive health, we have to create something innovative, something fill their needs, something they are achieve their expectation. We have to start this if we are wanted to working in family planning for adolescents and reproductive health. We have to start early when the girl and boy that they can reach to 12. We have to know exactly they have to play with the community. They play, not play for playing, play that you are do the rule in the community. They have to be aware about sustainability of the community. If you are here today, and if we will not say that we didn't have sustainable resources, but we have to maintain these resources. What was going later, we didn't know. So we have to reach their minds. We have to engage them in the plan, in the strategy, in the community and the environment strategy. We have to engage them in all our action. They have to play with us. They have to support. The adolescent today, it is the future, it's the tomorrow. If you are not built you today, you will not find somebody to take care of you when you are got elder. Adolescents need more support. Adolescents need more protection. Adolescents need this what we call innovative way to help us. Thank you.
No, excellent. I think, the one of the important thing which you mentioned, that this adolescent is a digital generation population, and we have to think out of box, something innovative, and get them engaged, get them interested in what we want to tell them. And that's why, advocacy plays a major role. If we really want to bring adolescent SRHR on the top of the agenda of the politician, so advocacy. But in terms of advocacy also, some actions need to be carried out, whether in terms of, collecting more data sets. And I think, to my mind, another barrier is, there is a lack of information around adolescent SRHR. We do not have adequate information. We do not get periodic information. So I think unless you have data strong, you are not in a position to do a right kind of advocacy. I think we will discuss
Of
those
course,
points,
sir.
how to do that kind of advocacy. But the point
Of
is
course, sir.
absolutely well taken, that adolescents, youth have to be brought on the forefront. They have to be part of the policy discussion. They have to be brought on the table. Only then this particular agenda will move. and they will come up
Yes,
with
sir.
innovative ideas. Absolutely fantastic. Yeah. Good. Thank you
Thank
very
you,
much,
sir.
Hayati. Thank you very much. Great. Yeah.
Thank you, Dr. Khera. This is Danielle Garfinkel with EngenderHealth. I work on the Impact Research and Evaluation team, and just had to give a plug since you mentioned the need for data. And I think with adolescents, particularly those in the younger age group, those 10 to 14, we have very little data on them, and seeing as they're, they age into the next age group quickly. So having their data is really important for program planning.
No, absolutely. I think to my mind, when you talk about accountability or advocacy, you just can't do advocacy, without a solid data sets. And I think this is one of the weakest area in the area of adolescent SRHR in particular. So that's why I think data are really very critical. And we need to come up with some kind of ideas that how we can, be more richer in data so that right kind of advocacy can be carried out. Thank you very much, Daniela, for raising this important point. Thank you.
Hi all, this is Amanda Livingstone. I'm Senior Advocacy Officer with White Ribbon Alliance. I looked for how to raise my hand, but I was not successful, so hopefully I'm not cutting anyone off. But just to add to what Danielle said about data sets, I also just want to highlight the importance of lived experiences, especially of those who aren't included in those data sets. And so just really reaching out, and it requires more resources, it requires more time and effort, but reaching out to those adolescents, particularly those who are specifically marginalized, young women, folks who identify as LGBTQ, young folks who are disabled, and really understanding what they want for their own health, because I think it's quite different often from what NGOs, from what donors, from what governments assume that they want and need. So including them in those decision-making circles, including them in those conversations, and making sure that those lived experiences and those stories that they have to share about their own lives and what they want are really front and center of these family planning and other interventions. Thanks very much.
Absolutely. I think the point which is being talked about, and thank you very much, Amanda, for again, raising this point of data, and particularly in the context of, so-called the marginalized population, and they are, generally missed while these, variety of surveys are being carried out. I would like to share, like, something which is called as the DHS, or people call it National Family Health Surveys. Most of those family health surveys, they capture information from the age group 15 to 45, the women of the reproductive age group. But that particular, the so-called the critical age group of 10 to 15 or 10 to 14 for that matter, is absolutely a missing link. And I think that's the population where we want to understand their behavior, their knowledge, their practices. So unless, we become rich in data, we won't be able to make a change in our adolescent SRHR program. And maybe, we won't be able to achieve our so-called universal health coverage goals, And data is absolutely the power. And for any strategy preparation, these data sets are really very helpful. Thank you very much, Amda.
Yeah, this is Anna from EngenderHealth. Just to add to the conversation, very much agree with the data points made. I'd say for me, it comes down to integrating adolescent, in particular SRHR, into UHC. For me, comes down to gender and power dynamics at play. And oftentimes we see the compounded stigma that is associated with being young, with being, in some cases, a woman, and with talking openly about sexual and reproductive health and rights. So in addition to listening to young people and what they actually need, and adolescents in particular, I think it's also on all of us to start, as we listen, also doing what we can to shift power and shift power structures that continue to undermine those voices and continue to put us in this place. And oftentimes I think about advocacy in the form of politicians, and politicians are a part of society. So politicians face the same gender and social norms that you and I face, and perhaps they're at more heightened play. But thinking about how do we push this agenda in a way that is not reinforcing harmful gender norms or stereotypes, when it comes to adolescent SRHR, or placing blame or talking about risk reduction as opposed to adolescents being able to make choices about their lives, and part of their lives are their sexual and reproductive lives. One piece, an important piece of the larger UHC puzzle. So would be curious to see what other people think about that. Thanks.
No, absolutely. I think, Anna, you raised a very interesting point and an important point. So gender-related barriers. I mean, in terms of accessing the services, or in terms of reaching our UHC's goals, gender needs to be addressed, and this is one of the important determinant and a barrier. Thank you very much for highlighting this important area. Any other point which anybody will like to mention, or we may go to the next the theme as a recommendation, but maybe if anybody.
Yeah, I just wanted to actually hop off of what Anna was saying about, putting power in the hands of young people, of their own health. So, I mean, there's been a lot of discussion around self-care, and I think self-care. There's really an opportunity for women and young people to access care without worrying about some of these barriers we've been talking about. Worrying about stigma, about transportation. I think, talking about self-care interventions, they can really help address some of these socio-cultural barriers and physical inaccessibility that can really limit access to universal health coverage. And, if we're thinking about how can we actually implement these self-care interventions well, then, self-care could equip people to make healthy and safe decisions about their own care. And it can really sort of enable people to manage their health issues safely. Self-care really puts them in charge of the areas of their own health, so that they can, better manage their sort of, on their own terms. So it's really placing that power directly in the hands of individuals.
No, absolutely right. And the point which you are talking about, particularly the issue of self-care, and in this COVID environment, I think this becomes more important, where there's a further, kind of a challenge in terms of accessing these services, whether SRH services or other services. So self-care is a very good concept which can be put into practice. So thank you very much, for making a kind of a recommendation. Thank you. I have, one or two. Yeah, good. Yeah, please.
I also, thank you. I joined a bit late, but I listened to most of the conversation. I want to just follow with what Stephanie said, that on the project that I work on in Nigeria, we before the inception of the project, we did extensive study to harness data on 10 to 14 and 15 to 19 years, girls, boys, married and unmarried. So I want to follow up by saying that I don't think, and I speak for the project I work on, data may not be the problem. It's about this self-care and self-agency, being able to bring adolescents and young person to the table and share data with them and actually ask whose reality are we actually programming for? Is it for the adolescent? Is it for the donor agency? Is it for the community? So I think this is one direction that we should be focusing on. How do we give them the power to be able to say, this is what we think the problem is, this is what we think we should be doing. And they may be wrong, they may be wrong. So we should be able to say, okay, this is the middle of the road. And a good way to do that would be to advocate for policy for 100%, quality engagement of young people in most of the thing that is happening. Thank you.
Thank you very much. In terms of, raising the point on quality engagement of adolescents, only then, we'll be able to solve this problem of, universal coverage in the context of adolescent SRH. Thank you very much. I have two more points, which I just noted. And one of the point which I like to put forward, maybe I'll seek your reaction also. that something called as the quality of the comprehensive sexuality education in schools is of not of a good quality. There is a compromise on the quality, because quality is one of the parameter for UHC, and there are large number of children who are out of school. Like in India, I know that more than 50% adolescents are out of school. Unless we have a system of reaching this particular chunk of population in terms of providing comprehensive sexuality education, we will not be able to achieve so-called the goal of universal health coverage for adolescents. That's one. And another point which I want to supplement at this point of time, there is something which is very critical, and at least in Asia, the provider bias remains a critical issue in terms of access to services. Generally we find the providers are biased, and they become judgmental, and that's why I think this is another barrier which needs to be addressed. So these are the 2 points which I wanted to add in the discussion. But anyone who likes to add more points in terms of the barriers, and then we go to the next part of this roundtable in terms of finding out solutions. What is the solution? What is the way forward for achieving adolescent SRH UHC goals? Anyone who would like to volunteer to say anything before we move to the next session or next part of this particular session? So if there are no more remarks or questions in terms of the barriers, then let's try to understand what is the solution now, what needs to be done to improve advocacy, to improve accountability, and so as to achieve UHC for adolescent SRH. I think the point which has been well taken and spoken by many of these participants, that we need to come up with the strategies of putting adolescent and youth at the forefront. They have to be on the table. They have to be part of the discussion. Unless we bring them on board, we will not be able to do a right kind of advocacy. And even there'll be a problem in acceptability. So this is, one point which has already been said. And maybe in terms of the next action, somebody also made a mention about, self-care. I think it's a great solution. And there's a lot of learning in the area of self-care. So this could be, another important thing, we should be promoted as a self-care in the area of SRH, keeping in the background the stigma around it, and keeping in the background the socio-cultural barriers. And then the third point, which has already been spoken about, is data. Because everything is data, whether when you talk about advocacy, you talk about accountability. Without data sets, you are nowhere. And I think we need to address this issue of data gaps in this area. So we might have to invest, as one of the strong recommendation, that we need to invest in collection, not only collection, and even terms of utilization of data for accountability, and as well as for the advocacy. So we have to do some kind of a facilitation in terms of data visibility and use. So that is another recommendation. So these are the 3 recommendations which I have just summarized, because these points have already been raised by the participant of this roundtable. So now I'll request the participants to tell me something more. What more should be done, Yeah.
Okay, sir.
Yes.
I have something more with full respect to all the participants and to all the attendees, and for your experience, sir. What you mentioned is really amazing. I'm working in family planning as academician, because I'm working in Salsa University. But my master and PhD, it was in family planning, and I'm the advisor for some association for adolescent and sexual health. The issue here, if it we really want, my recommendation, we need a reproductive health clinic friendly adolescent reproductive health. This is really important. This is the first. The second one, we need to engage to engagement of reproductive and sexual health with another social activities. So the adolescents they will come not only for reproductive and sexual health, but for another activity like drama, like music, like this is handmade. So this is very, very crucial, sir, if it we need really to engage these students and they take what is really what we are want for them. We need really to meet their needs. As some of the participants they mentioned regarding, we have to start early. This is information, and when we give them information, we have to give them the information in innovative way, in digital way. They are not use any classical way. They are reject what all tradition. And if it won't really, we have to take from the role model from the adolescents themselves. We have to use them to encourage them. We have to use them to force them, because the adolescent now, they are not believe in elder generation. They are not believe, they are considered the elder generation, they are weak and they are not reached to their own way of thinking. We are now, we are in digital. When they say digital, we can use computer, and you didn't and able how to use your mobile or laptop. We have also to going through culture and the tradition practice. We have to engage this as sociologists to know exactly how the people they are think, to reach with them what we are need from them. Thank you, sir.
No, thank you very much, madam, for raising this important point, that we have to talk to adolescents, we have to understand, and in order to understand adolescents, we might have to bring social scientists on board. Only, there's something called as, human centered approach, because these problem of adolescent SRHR is not a medical problem. It's also a social problem. You have to understand the mindset of the people. That's why
Yes, sir.
human centered approach and must be applied. I think this is a very great idea, and which we will
Yes,
try
sir.
to put forward. Fantastic. The
Um,
another point in which I'm, yeah, please go on. Yeah, yeah.
sorry, I just wanted to cite the Passages project. In that project, it was a research project, is a research project. And the researchers included 10 to 14-year-olds. This is in the DRC. And, they did the data collection, they did they were empowered to do the research within their community. And it was around shifting social norms, identifying and figuring out ways to shift those norms. And they were able to, the young girls that were doing the research became advocates and respected advocates in their communities at a very young age. So it is possible to work with those and engage with youth to take on their own research and their own advocacy. And I think that's really important.
No, thank you very much. I think because adolescents will have to take ownership, they have to take responsibility, and we as the guardians also need to give them that kind of authority to decide, authority to act. So we now they are kind of adults, so we have to give them that liberty. So thank you very much, for bringing that point, upfront. Thank you. Yeah, any other point?
Yes, sir. Yes, sir.
Yeah.
So sorry, I'm talk too much, but because I'm just engaged in all this is gender violence, gender-based
Okay,
violence,
okay,
and the
great, great.
adolescents. Yes, sir. Yes, gender-based violence. We have to talk about this, because we have to make a link between this is gender. We have to solve all the issue related to gender equity and the equality. We have to use the adolescents and the power to movement our community. The adolescents they are highly enthusiastic. They are highly powered. They have a great idea. and they are think beyond our expectation. We have to listen to them carefully, and we have to use them effectively. This is, I said, we have to engage them in all aspects of gender equity or gender-based violence or something like that. We have to what we call invest in their power. We have to give them some employees or some work to working to build our universe as our community. Adolescent, when they are, give them the power and give them the trust. You can't imagine how far you can reach your objective. Use the adolescents and with the social norm, and all this is social determinant. It is really very critical. Gender equity, it is really, really critical. Source of information based on that tradition and the culture. Because if we are just going to break their tradition and the culture, they will reject all of us and they will against us. They will not move with us. They will be the power against us. So we have to respect their identity. The adolescent now, they have new identity. It is like sorry for this comparison, like COVID-19. It is a new virus. We didn't know exactly what it is. The new generation, we really need to know more about them. We have to study them well, not only in aspect of family planning, but on aspect of education, in aspect of health seeking behavior, in aspect of how to build their community everywhere, not in Nigeria, in Egypt, in America. The adolescents looking for all around the world who are move the community is adolescents. We have to respect them. We have to meet their needs. We have to use them powerfully. Thank you, sir.
No, no, absolutely. I think the point you are said is in terms of, giving identity to the adolescent. Actually, we must believe in the philosophy of something called as the generation equal world. We have been speaking about something called as the gender equal world. I think it's a high time
Yes.
that we should start raising the voice in terms of saying it as a generation equal world. And one generation is the adolescent generation. Fantastic. I think the point which you raised is really very important. And we have to consider adolescent as a powerhouse, as a change agent, and we have to keep them as the champions in the community, and they can really
Change agent.
do wonders actually as a change agent. I think all those points are absolutely valid, but all these points needs to be put into practice. They have to be on the ground actually. But we have talked about, but now the
Very,
next point is how to put them into practice now, how it will be done.
very, very critical, sir. I think you
Yeah.
mentioned that maybe in some countries, not all the adolescents in the school or the university. That is the
Yes.
meaning we have to looking forward. This is the girls and the boys and the adolescents and the youth outside. Why? Because this is really, it will affect negatively our movement of the community. What we have to do, we have to go for this is social association. We have to create social association when we are recruit all this is unemployed youth or uneducated youth to change their behavior toward working with the community. You understand me, sir? Because
Yes.
as we have lacking of information, as you have lacking of correct knowledge, they consider the other educated, they are working against them. No, everybody is working in his field and will not left you behind because you are not going to the school or you are not going to the university. No, the community needs your rules based on your capabilities and performance and competency. We have to use, because these people, they really affect when the student in going for vacation or going after the going for the school holiday, they are communicate with these people. They can change their mind because, and they can bullying sometimes, they can working against their what we call against the positive movement that the community is need. So we have to working as the practice. We have to working parallel. This is the educated adolescents and non-educated adolescents, employed adolescents and non-employed. We have, because we are not leave anyone behind. You are a member of the community, so you deserve health, you deserve education, you deserve safety, you deserve to live in social content. This is very critical. And what very, very crucial, sir, it is the mental health. I'm so sorry to say, some adolescents, they are suffering from mental health problem because they are not have a chance to going for the community. And I found some students attempt to suicide. Why? Because they are his own ambitious or his own idea just to join the university. No, it is not to going for the university. It is the only way to improve yourself in the community. It is not like that. Okay, sir. I'm took too much. So sorry, sir.
No. I think we need that kind of a discussion to happen. And the point which you raised was the mental health issues. Certainly, adolescents are affected by a variety of problems, whether it is nutrition related or whether they are mental health related, whether it is drug abuse. But SRHR is supposed to be the major chunk of the problem. If we can equip them in terms of addressing their SRHR needs, we have really made a change in the life of adolescents. But certainly mental health, nutrition, all put together. But the policymaker, we need to do a very high level advocacy, because generally policymaker, because adolescents do not die, and the policymakers, they only look for mortality. What is your maternal mortality? What is infant mortality? Adolescents do not die. So we have to change the dialogue. We have to change the dialogue. Yeah.
Sir, I have one presentation I submitted in one webinar. It is One Health approach. I'm really like this One Health approach if it to apply, because they are engaged all the sectors in the community. In here, education, culture, environment, and agriculture, policy, academician, everyone are One Health approach. Everyone have the role to improve the community. It is not only academician, it is not only the government, it is not only non-governmental organization. We all live in the community as a whole. We are a big family of mother, father, and the children. The community, we have the community, we have president, vice president, we have a minister. It is like a family, but in big shape. So all of us, we have to working with unity, with reality. This is the issue. When we are think like we are a family, and my country, it is my home, it will be very, very nice, sir. Thank you.
Thank you. I think we can have more responses, that then we might have to close it also. Maybe we can have more reactions in terms of actionable, what needs to be done, to achieve our UHC goals, keeping in the backdrop advocacy and the accountability agenda. What more needs to be done? Any person who will like to comment or make any observations?
Dr. Khera, I would actually love to ask a question, given your experience as the former commissioner of the Ministry of Health in India. How did you prioritize adolescent and youth sexual and reproductive health in your policy making in that role?
To be very frank, I have tried to bring adolescent on the top of the agenda. Whenever I used to make any statement on the MCH program, I used to say everything has been done in the MCH space excepting SRH. SRH is the most neglected portion. And unless you address SRH, you will not be able to achieve your MCH goals. You will keep struggling. And the kind of the outcome which you get in investing adolescent is not only in the area of mother and child health, but they are beyond mother and child health, like reducing non-communicable disease risk, reducing, HIV/AIDS risk, beside, reducing early pregnancy. So I think advocacy needs to be done. And another thing which we started in India was something in data, which I am very, very keen to start with, something called as the youth poll. Every year we should have a youth poll to get a pulse of what is happening in the youth of the countries. There is a world youth, I think some survey is being carried out, but I'm more interested in getting it, every year, a poll. So those are the approaches which you tried. And for advocacy, getting a handle on the information is most critical. So that's one. Thank you very much for asking this specific question. Another point which I want to raise is, because
Yes, sir.
family planning, stigmatizes unmarried youth. Because
Yes.
sometimes I've seen people equate SRH and family planning in the same breath. But as soon as you use the word family planning in the context of unmarried youth, they get stigmatized. So I think SRHR
Yes.
is a more enabling entering point than a family planning. But I think it's the right time that, and people generally link, family planning with the population controls. And I think need of the hour here is that SRHR, and we need to kind of, redefine SRHR and make this an SRH as one of the important initiative in the overall concept of health. So that was
Complete
one.
is correct, sir.
Yeah, another point which I should not miss, something, because most of these adolescent programs, if they are just vertical programs, they won't succeed. We might have to think of some kind of large scale sustainable, multi-sectoral, multi-platform communication strategy for providing the information. Adolescent health has to be an integral part of every sector, health in every sector. I think that is the theme and agenda of SDGs. I mean, you just can't address adolescent health issues just by having adolescent health clinics. It has to be integrated into every sectoral activity. Because if you go and talk to adolescent, what is your problem? They say, my priorities is education. My priority is skill development. My priority is employment. Health comes on the last. So you have to, continue to wait for them to change their behavior and the practices. So I think the smart approach will be that we must introduce adolescent health as an integral piece of all sectoral activities.
Yes.
So this is
Very good,
another
sir.
kind of recommendations. And another important point which everybody has said is very critical and important is that we need to, co-create, action plans with the interministerial partners and including youth. We should never forget youth when something is done for youth. If we are making a youth plans with the other sectors, youth has to be part and parcel of the discussion. I think that point has come up, number of times.
Yes,
Any
sir.
other person like to add any other thing?
I have one idea. I'm so sorry, but I have another idea, sir. You give me one cue for this one. You mentioned that somebody, the adolescent, they are take the health as not by priority. So we have to really rearrange the value of the health, the value of life. Because some people, I asked some, I used, what do you want it to be? He said, I wanted to have a lot of money to go to the chairman of the man in my village, and I will ask him to marry me his daughter. I said, this is the issue. Yes, because I noticed that everybody have the money. He can do everything. You can imagine, and not only him. He just to show to us how this our generation they are think about. This is we have to rearrange the value of the life, the priorities of the values in their life. This is very critical. And another issue, we need to community mobilization. If you are not able to come to us, we come to you, especially in low resources setting and the rural area. We need to mobile clinic for everything. If you are not able to come for us for any reason, you didn't have time, you didn't have money, we come to us with all our capabilities to to give you what you are looking for. Some people, they are really lost their life because they didn't have the money for transportation. Some people, they are died. Some women, they are died from postpartum hemorrhage because they are not able to going to find family planning. Is really wahala. Sorry. Thank you, sir.
Good. I think, let's hear some more reactions from some more participants if there are. Any other who would like to make, any remark? Because two important points are missing actually, which I wanted to add before I close this session. So if there are no more remarks from the audience, then the one important point is, in terms of, ensuring, the commitments which are being made for adolescent SRHR, they have to be specific, they have to be measurable, and they have to be evidence informed. If things are not measured, they are not done. So we have to create those kind of commitment which are specific and measurable. And last but not the least, that we also have to facilitate some kind of clear accountability system also has to be put in place. Otherwise, things will become haywire. We will not reach our goals. We have to make people accountable at different levels. And last but not the least is that we have to identify and commitment for the budget support, because without money nothing moves unless the countries invest money in adolescent, and that will only be possible if they understand the value and the importance of investing in adolescent health. Adolescent health investment is a triple dividend. It is a kind of intergenerational effect of investment. I mean, adolescents are healthy. Once they become parents, they remain healthy. They become mother or father, they remain healthy. And even their children are also healthy. So I think investment in adolescent is a real public health cost-effective intervention. So with these few words, I think I stop here. But I mean, any comment from your side, from any person, is most welcome. But I think it has been an interesting session in terms of understanding the adolescent SRH barriers, and the variety of recommendations have come. And I think we need to take it forward in terms of doing a right kind of advocacy and putting right kind of accountability system in place. So with these few words, I stop here, and I'll request, the session coordinator, Zandria, if she would like to, do some kind of a very quick evaluation. Zandria, please.
Sure, I can do that. Here is this is something that each roundtable is doing, so this is not specific to us, just in case you are wondering. But if you want to go back to view options and go to annotate, you can click on the little heart option or whatever option that you would like and tell us how pleased you were with today's session, whether you were or not pleased. It's anonymous, so it won't hurt our feelings. Just click on.
Sorry, it was amazing. Was amazing. I'm really happy because I'm showing in this conference. I was young stuff when I attended the first one in Egypt. I was just clinical instructor and I attended one. And really, I'm so happy that I'm working. I'm joining this one when I'm professor now. I wish you all success. It's really
Thank you.
great,
Thank you very much, madam. Thank you very much for your input, madam. Thank you. Great. Yeah.
Well, we are pleased with the people who have said that they were pleased with the session so far. So thank you. And we have hearts in other places, but we'll just pretend that those are all good hearts. All right, I'll save this real quick. All right, that's good. I'll go ahead and stop sharing it since we're a little over our time.
So is the time over, or?
Yeah, we are past time, so we are good.
So we can close the session now?
Yes, we should be good.
Zandria, you can close. Yeah. Okay, then. Thank you very much, everyone.
Yes, thanks, everyone. It was great to see everyone.
Bye-bye.
Okay.
Bye-bye. Bye-bye.
Thank you.